Hey there, my brilliant leaders, my brilliant healthcare providers. Love working with you guys. Gosh, I love working with you guys. You're doing such incredible things in such incredibly unique ways. So here's what I want to do today. As I'm talking to my providers that I work with and as I'm flipping through socials, there's something that I keep seeing, and those are the things that I like to bring here, is to help you go from insecure and unsure to confidently and comfortably offer and recommend those treatments and those premium services. This is a big deal in helping that practice be fun and fulfilling and prosperous and profitable. I help you develop, lead, and expand your fun and fulfilling, prosperous and profitable dream practice where you get to be that caring and compassionate provider that you want to be. I'm Marinda Nelson. This is what I do. Okay, here we go. So, 8 things to help you really be confident and comfortable offering those treatment recommendations and those premium services. All right. You are the patient's resource on their healthcare journey. They have a desire that something be different. They have concerns about a thing. They now are in your clinic, in your hospital, and they are looking to you for recommendations. You are a resource on their journey, and they came to you. And them being in your chair or in your hospital or in front of you means that you get to do what you love. All right. So, this is an opportunity for you to do what you love. You love working with these people. Now, you have this dream, right? You have the dream practice, you have the vision. So, you've curated your treatment options, your premium services, your retail spaces, your waiting rooms, your exam lanes, all to fit with that vision for your dream practice. See, it makes it really easy when you have this vision. This is something I help you do in our pre leadership work. If you want more help with that, let me know. I can get you that information. That's where you start doing work with me. And I'm here, right? I love working with you all. I know there's so many amazing providers out there that just aren't seeing it done the way that they know that it can be yet. And I help you be confident in you. I help you be comfortable. I help you know that you can do it. I did it. Gosh, if I, some awkward, sick kid from rural Wisconsin, can do it, you can do it too. And do it authentically and do it in a way that really feels true to you, really feels fun and fulfilling for you. Okay. So you are a resource on their journey. They have come to you. Number 2, their choice is not reflective of your ability or responsible for your well being. I'm going to say that again. Their choice is not reflective of your ability or responsible for your well being. Okay. They get to make their choice. It doesn't have anything to do with whether you can do this well or not. You do a great job of what you do. I know you do. You care. You wouldn't be here if you didn't. All right. And unattaching what their choice is from your well being. I know you have metrics desired. I know you have goals. I know you have bills to pay. I know you have all of this in the back of your head. It needs to not be there when you talk to your patients. Okay. When you show up with them, you show up with them. You are a resource on their journey. Okay. You make these things happen. You provide for and protect your values, dreams, and desires and your full expression, right? And so by setting it up and by curating it, you know that you call the patients in that you got your well-being handled, right? You know that you take care of your needs and you got this and you're incredible at it. Okay. So they're not responsible for that. You got this. Okay. You know that. I know you know that. I know I didn't need to say that. And it is something that I saw over the years. So I'm not going to belabor it. Here we go. Number 3, you're familiar with your options. You know the services that are available. You know the treatment options that are available. You love this stuff. You geek about this stuff, right? So we read about it, we learn about it. You are their resource. So you know these options. You know them. That one's easy. Number 4, you respect them enough that you've listened to them. You've heard their desires and their concerns. You're making a recommendation. You're letting them know the options that are available. And you respect them enough to make their decisions. You are not responsible for making their decision for them. You are not responsible for taking and filtering options off the table that they didn't ask you to. You are a resource on their journey. I'm going to keep saying that. You are there to offer the options that are available. Now you're listening to them. You respect them as empowered decision makers to make the decision that's for them. So you are simply pairing what you are offering with their desires and their concerns. Okay. You're going to educate them on, then, this is 5, on the options that are available. Hey, this one's available, but I heard you say that. So I don't know that that's the one for you. Tell me if you want to hear more about that. I also heard you say that this was a concern. And so this is available, but I don't know that that one's quite for you. This is the one I think is going to work for you best based on what I heard you say. But this is the one that I think is going to fit your needs best and do the best work for you. Let's talk about those two some more. Or this is what's available out there. What are your thoughts? This is what's available out there. I'm seeing on your test results and I'm hearing that this is your desire. I think this is the best one for you. This is what's tricky about it, or this is what I'm not sure quite meets your goals and desires and concerns. What do you think? What are your thoughts? Okay. Does that sound better? Does that feel better? Instead of just pushing this one, you respect them enough to let them choose. You're educating them. You are a resource on their journey. All right. I think this is the one that's going to work best for you. Let's see what you think. Okay, it's the most expensive one out there, of course. Yes, right? I know. And this is why I think this is going to work the best for you. Okay. Sales is influencing and discussing towards the thing that you think is the best for them. All right. I didn't number that, but that's simply what sales is helping them choose of the options that are available, what's best for them. So you're educating them, you're informing them. Okay. Number 6 is a concept that, man, changed my world. And this is one that you have 100% control over. It's not going to sound like it at first, but you do. So give me just a second and I'll explain it. I remember it was actually a sales rep said this to me. He said, yeah, is that a complaint or a comment? The thing is, you choose. You choose if they're telling you a comment or if they're complaining. Okay. And some of how that choice comes to be really comfortable is that you know that you educate them on the options on the front end. Okay. So I've been working with my dad and his cancer treatment, and, every chemo is going to hit patients different. It's going to. Here is some of what I'm hearing from my patients. Here's some of what I'm seeing. Okay. You really speak to the thing. And then when they come back and they say, oh, I'm really drowsy. Yeah. Okay. Well, that's one that we talked about, right? Yeah, it is. Is it handleable right now, or is it something that we want to make some changes on? And then you acknowledge it. You simply acknowledge, yeah, yeah, that's a thing we talked about, isn't it? It's a real thing. And you validate their experience because you respect them. Okay. Yep. We talked about that. Is that something that you're cool with right now? Or is this something that we need to make some changes for? Okay. Yep. We talked about that. This is a thing that can help with that. Yep. I know. It's part of the healing process. Yeah, we talked about that. I know, right? Gosh, yeah. Part of it. Darn it. To be real, be real. They're humans. You're a human helping humans. Okay. They're an individual human. They get to have their experience. So that is it a complaint or a comment? Okay. And this is where you doing what you can on the front end to help them be comfortable, to hear them, to speak to them. That's where this buy in happens. That's where this recommending, listening to them, having them feel comfortable and respected that they can speak to you. Because even if it's a $4 generic tablet, if they don't take it, it doesn't do any good. Right. And then you have phone calls and then you have follow ups and then you have frustrated patients and then you're frustrated and then your staff's frustrated. And then, right. So, really taking that extra, I know on the front end, this is tricky. Okay. I understand this. And taking that extra 30 seconds on the front end to make sure that they're in on your treatment plan, that they really feel that it's the best for them, that they really felt heard, and that they're in to try it. And then you can get rid of some of those phone calls and some of those um, follow up visits that kind of were pointless because they didn't really do the treatment. And that opens you up then more space to do what you love. Okay. So spending that extra 30 seconds on the front end actually buys you, 5 minutes, 20 minutes on the back end. All right. It's worth doing. It does take a bit for it to come full circle. Okay. So do have awareness that what you do now doesn't maybe show up for 6 weeks, 2 months, 6 months. Okay. All right. Number 7, celebrate and reinforce their decision. Okay. So if they choose the $4 option or if they choose the $4,000 option, they chose what they think is best for them. And that's what you want them to do. You're a resource on their journey. They chose what's best for them. Hell yeah, you did. Yes, that's absolutely the best choice for you. I'm so glad you chose that. That's exactly what you were telling me. That's the perfect choice for you. Awesome. We're going to do that. Yep. I think you have all the information. I think you made a really good choice for you. Okay. You're going to validate that. That's their decision, whatever their choice. So they're not going to feel bad about not picking the top option if you're validating the option that they picked for them. So talk about referrals coming back to you. Talk about maybe that one didn't choose the premium option, but maybe now they know it's available and they're talking about their friends. That you weren't pushy and salesy and yucky, but that you have this option that was available and that you recommended it and they chose to not get it, but that it might be a good option for them. And then that person comes in and then they do the premium service. So if you had kind of pushed it on this person that didn't feel comfortable about it because you attached your well-being or your numbers or your sales to that person, that wouldn't have worked, but it's going to come back around, okay? You're not speaking to one person. You're speaking to that person, but everybody in their circle, okay? So when you are making recommendations, when you are saying, yes, that's a great choice for you, I'm really excited that you listen to yourself and that you're picking what you want. That's what you've done, right? You've listened to yourself and you're picking what you want in your practice. You're developing, leading, and expanding your dream practice. So you've listened to you and picked what you want. So you're hoping that they do the same. And when they do, whatever option that is, you're going to celebrate that. Okay. And then know that people feeling heard and respected and celebrated and empowered is how they want to feel with their provider. That's, you want to feel as a provider. And so you doing that is going to bring it back tenfold. Okay. This is how it grows, how it gets to be prosperous and profitable. All right. So even if that patient didn't choose the most premium option, that doesn't mean that they don't know people that will, that are going to send them to you. Okay. So you're curating your options toward whatever your dream practice is. So maybe you no longer do the standard option. Maybe you're like, you know what? That's an incredible choice for you. I love that for you. I have really chosen to focus on this other option. So I know I talked to you about this one because it was available and I thought it was one of the choices I wanted you to know about. I don't do that one any longer. So I'm going to refer you to this incredible surgeon. I'll talk to them and get your name in there. They're really, really detail oriented, whatever the adjectives are that are important that they've said, mirror a little bit. And then they're gonna take this incredible care of you. That's all they do. They don't do these premium things. I do these, and then we refer back and forth. So she's gonna take incredible care of you on this thing. I'm so excited you've made that choice. That's amazing. So come back and tell me how it went, right? I want to hear about it. Now, number 8, train your team. So you're leading by example. All right. Leadership, 6 arcs of leadership, 6 concepts of leadership. Awareness, lead by example, train your team, empower, encourage, and redirect. Train your team. Now, you're going to make sure that as you have curated these options, that you're leading by example and you're doing the thing and you have this vision that you're working toward, right? But that you're training your team, not only on the technical components of this treatment option or of this premium option, but that you are training them from the front end to the back end and all of the way through from the website to their last post op with you or their last treatment or their last appointment with you, all the way through. However you do it, however you have it set up, make sure that there's consistent language, that there's consistent values, that your team knows why you think this is the best option for that patient. That's how you go from unsure recommendations, patient buyer's remorse after, or non-compliant patients. That's how you go from that to confidently and comfortably offering your premium services and having that full buy-in and compliance with your patients. Okay. It's possible. This is a part of prosperous and profitable practice. This is a part of having fun and having it be fulfilling. Okay, is where you have this arc go all the way through and you set up the processes. This is something I help you with when I come in and I do consulting with you. But when you have this vision for your practice, these decisions become easier. Then you just curate towards that. And when you know what that feeling sense is that you want and you're committed to it and you know you got this and you know how influential you are in your own world, you know you got your back, you know that you set up the systems and structures to support you, you're going to make these decisions that support that vision. Okay. All right, you guys, be brilliant. I'll see you soon.